whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 14th of November and the time just past 6 p.m. We are casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden and Bedford. Our positive airwaves reaching to all our listeners who are listening us through Inspire FM app, website, or you can view us live from Facebook Live and YouTube channels of Inspire FM. If you're listening to the show on Sunday or any other Thursday, that means it's repeat. But hey ho, it's not repeat because today is 14th of November, 2024. Wow, the time has passed so much easily, isn't it? It seems like yesterday when it was January. Now it's back in November. We are now seeing short days and longer nights. As we all know, we cover different health informative topics every week. So today's topic is slightly different because in some people's eyes, it's a bit controversial. And you know what controversies are exactly. So as we know, health and well-being is very important regardless whichever part of the health we are looking into, and today's topic is looking after our health in a slightly different manner. Yes, indeed, the topic for today is World AIDS Day. Yes, indeed, you have heard me correctly. We are talking about World AIDS Days, AIDS Day. And it is a topic where we will be discussing a bit more about what is how we can look after ourselves and well-being, and we will be sharing about information on what are the relevant knowledge and information regarding this sensitive topic in a more sensitive way we can discuss with our public, with our general listeners. So, and you will be very happy to know that I'm not the one who will be talking about this. I will be a person. I'm just merely a host who's posing all the questions to our lovely guest. And joining me today in the studio is our joining us for the very first time. It is Kelsie from Luton Sexual Health Services. Good evening, Kelsie.
Good evening. Thank you very much for having me here this evening.
Thank you so much for coming to our show and coming to our show to empowering us with this knowledge on World AIDS Days. Welcome.
You're very welcome. Thank you very much.
So please tell us about yourself and about how you end up in this field, and tell us about your organization as well.
Absolutely. So my name's Kelsie Holdstock. I am the Education and Outreach Lead at Luton Sexual Health. So what that involves is running a team of people who work very hard to kind of do our best to create equitable access to sexual health care. So what we want to do is reach out, be as accessible as possible to as many different communities as possible in our town, and make sure that we are sharing the information that we need with the people who need to hear it. And generally sort of being there to support and listening to people and finding out what barriers they might face and what we can do. So our clinic is based in the town centre. We're in Arndale House. So anybody who's been to the blood test centre may have seen the signs for Luton Sexual Health before.
Indeed.
So we provide contraception for thousands of women across the town, across Luton and surrounding areas, as well as STI screening for all regular STIs. We also provide care for around 900 patients who are living with HIV, and we work very hard on the prevention of HIV within our service.
Wow. So in your area of expertise, what is your area of expertise, and how did you end up in this field?
Yeah, so actually I got into this field working initially with young women who were potentially at risk or involved in exploitation, and how we could support those women. And now that I am the lead of the education and outreach team, I have a more sort of overarching view. So I actually initially trained as a youth worker and worked with young people. And then in around 2017, I went to work at Luton Council, where I trained as a teacher. So I worked for Luton Adult Learning, teaching people who may not have had the best experience at school, but wanted to go on and do some sort of maths and English qualifications, those kind of things. But then post-pandemic, I was kind of just looking for a new challenge. And as someone who was a young parent and who had worked with a lot of young parents in my youth work, I saw this vacancy at Sexual Health, and it really appealed to me, because actually, as much as I liked being in the classroom, I really missed the outreach element of the youth work I did.
Yes, indeed. It is very, very addictive in a sense when you are interacting with people. I remember my vaccination days, because when you are interacting with those people in a slightly superior managerial role, where you can know when you know that you're making difference in a public
Absolutely.
eye, it is always nice. The World AIDS Day. What is World AIDS Day, and when is it?
Okay, so World AIDS Day takes place on the 1st of December every year. It was set up in 1988 as a response to the AIDS pandemic that took place through the 80s, and it started in New York. But we actually continue to mark World AIDS Day because it shines a light on the real experience of people who are living with HIV, potentially the stigma they might face, or how things have changed. And it also gives us a moment to reflect on how health can impact communities and the devastating effect that the HIV pandemic had throughout the 80s and 90s.
Well, unfortunately, that stigma is still is still here in this day and age. And as far as I know, there are many people, and I was listening to a podcast one the other day for a person who has gone through that kind of a personalized stigma in terms of how people have reacted to him when he was going through the treatment, where people end up keep making him an outcast in a sense, and it was really heartbreaking, isn't it?
Yeah, it's really sad. And I think that obviously we can't get away from what happened in the past, but actually if we look at the picture for HIV new diagnosis, there was a 30% increase in HIV new diagnosis among heterosexual couples since 2022, in heterosexual people since 2022, and also in late diagnosis among heterosexual women, so not being diagnosed until they're sort of 45 and they may have been living with the virus for a long time. And unfortunately, the issue is that the virus doesn't stigmatize, and it doesn't choose certain gender, sexuality, ethnicity, anything like that. But people maybe, and also potentially some health professionals, might think that people are not the people who need testing. And actually, that's why our campaign in Luton is so focused around HIV testing is for everyone, rather than just for any sort of specific target group.
Exactly. And it shows the importance of how it is. So in general, what is the story? I know that during the time of HIV week or HIV month, people wear red ribbon. So what's the history behind that red ribbon?
Do you know, I actually had to do a little bit of research on this, because I've always just known the red ribbon as being something that was associated with HIV. But actually, it was a visual symbol that was to show support for people living with HIV, so that they knew who their allies were. And it kind of started in New York in 1991. And actually, the reason the ribbon's red is because obviously the color red is associated with blood. It's a bloodborne virus, but actually also a symbol of passion and love, and how people wanted to show that those affected were not on their own and in isolation.
So in terms of HIV, what can you tell us about HIV and why the importance of celebrating World AIDS Day itself?
Yeah, of course. So I think the key message that we're trying to share is that people who are diagnosed with HIV, who have who access treatment, have long and healthy lives. So that means that their life expectancy is actually slightly higher than the general population because of the fact that they have to have such routine medical care. Also, people who are on treatment and who know they have the virus can be what's called U equals U. So undetectable equals untransmissible. That means those people cannot pass HIV on to another person, whether that's through birth or through relations. Anyway, they can't pass that virus on. So actually, the biggest risk to HIV new diagnosis is people who are living with the virus that maybe don't know they have it. And in order for us to work towards the kind of national aim of ending new HIV diagnosis before 2030, we need to make sure that everyone that's got it knows that they've got it, because they're the people that can pass it on, and then we can support the treatment and care of those people and hopefully put an end to new diagnosis just by encouraging people to test.
Indeed. On that note, let me introduce our listeners as well. So, listeners, if you have any questions or queries regarding World AIDS Day, or any questions regarding this topic, please give us a call on 01582 481822. I repeat, 01582 481822, or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. You can send your questions via social medias as well. You can send questions via Facebook app or YouTube channels as well. So in terms of the World AIDS Day itself, what can I do on that day? And you said it is on 1st of December. So why we are talking about it now?
Okay, so the reason why we're talking about it now is because we do a lot of work basically all the way through November as a sexual health service, leading up to the 1st of December, to basically use that period to really get out into communities, meet as many people as we can. Next week, we're at the Luton railway and airport station, kind of just talking to people there about HIV testing. We're going out as many places as possible and interacting with as many people as possible, just to kind of help share some of those facts, like some of that information that I might have said that people might not know about people being able to live well with treatment, but also just to encourage people who are sexually active to have a test. And that it isn't necessarily a test that's for one particular person, one particular group. It's for everyone. I guess another thing people could do would be to wear a red ribbon, show their support, show that they maybe have some sort of understanding, and you could get those from Luton Sexual Health if you want to. We're actually doing a World AIDS Day event on the 29th of November outside the Hat Factory on Butte Street, if you know it there. So we will be setting up a stand in the town centre. We'll be talking to people about HIV and about what's going on, and obviously offering lovely free hot drinks from the cafe.
Nice. Now that's something which I definitely like. I know I like information as well, but free drink, yes, definitely.
Exactly. We've got to have that little pull.
I'm on for that. I'm definitely on for that. So wearing red ribbon, creating awareness and interacting with people and supporting people is something which is quite common doing that day or leading up to that day.
Yes.
Okay. Now, one of the things people do get very, very anxious about is the testing itself. Now, what is the somebody who wants to get tested? How can they get tested? What what is the procedure? Because I remember in the good old days, they used to say that you need to do this, you need to do that. And I working in NHS, I have those knowledges. And I remember that just literally scared many people away from getting themselves tested.
Absolutely. So there's some different ways that you can access testing with Luton Sexual Health. One of those is to book a screen and go appointment, which is a screen and go appointment happens at our clinic, and it normally takes less than 15 minutes. We are able to book in appointments on evenings and weekends to be really accessible. And that involves a urine sample for a man, and a swab for a woman, which they do themselves. No one else would do that for you. You go off into the bathroom and get your own urine sample or self swab in complete privacy. So that's good. And then you have a needle blood test. And the blood test is for tests for HIV and syphilis. So that would be what's involved in a full STI screen. You can also get a full STI screen by ordering a kit on the Luton Sexual Health website, which is www.lutonsexualhealth.org.uk. If you go to the front page, it says order a home test kit. Now, if someone was interested in ordering a home test kit, they come in discreet packaging. They are just a plain cardboard box that's delivered to your door. You can either collect your own urine sample or do your self swab. And then it's a small finger prick blood test in that. So that just involves a slight prick on the end of your finger, and you squeeze it and collect a small blood sample. And then those kits can be free posted back to the lab. And they are tested in the same labs in exactly the same way with the same level of accuracy as our tests that you would get in clinic.
Yeah, because that was leading towards my next one, because there's a question just pop up on the screen asking, do I have to go to the clinic in order to get the test? And you just pretty much say it.
Yeah, absolutely not. Just head to our website and you can order a test to your door.
Yeah, because sometimes those discretions or regardless whichever age you are on, because it is, I think so, it's a very miscommon approach that it's just a young person's disease, which is not true, correct?
Absolutely. And I think it's fair to say that maybe in the past people did think it affected men more than it affected women, but there isn't any sort of evidence to say that the virus specifically affects men more than women. It affects people who end up being more sexually active than the others.
And without any age groups or boundaries?
Yeah, no. So age is pretty indiscriminate. We find that the average age for a man to be diagnosed in Luton is around 35, and the average age for a woman to be diagnosed is around 45.
Wow, that's a slightly mid-age range, isn't it?
Yeah, it is. And actually, for young people, we really encourage the chlamydia screening and chlamydia testing. That's the kind of higher risk for that 15 to 25 age bracket. And for them, it's really a big push around the chlamydia screening.
Okay. So in terms of, I know UK government has set goal of ending HIV transmission by 2030. How will we as a nation achieving this?
Yeah, that's a really good point, because obviously it's really good to recognise what we do in Luton, but actually on a national level, there are some really key messages from the government, and that is prevent, test, treat and retain. So that is talking about HIV prevention, which is through two different types of medication, one called PrEP, which is pre-exposure prophylaxis, which is a medicine that can be taken daily for our most high risk and vulnerable clients. And then a medication called PEP, which is a short course of medication that would be taken after any potential exposure to HIV. And then we're focusing on testing, how people can access testing, whether that's in the community or whether that's coming into our clinic or ordering a test from home. Treatment. So like we mentioned, those people who are trying to achieve that U=U status, so they can't pass the virus on to anyone else, and they couldn't pass it on to their children, anything like that. And then retain, which means making sure that the clients that are diagnosed as HIV positive are kept in the service, that they are supported, that their needs are met, and that they don't potentially change area, drop off, move away, and they get kind of lost in the process.
Okay, cool. So, sorry, carry on.
Oh no, that's what I was going to say on that bit.
So in terms of, because I know it is not easy. It is not easy to go through these lines, especially if you are going through a treatment in a person, regardless whichever disease group you're
Yeah.
going through, and especially something like this, it's even harder.
Yeah.
So, is there any mental health supports available for people like that?
Yeah, actually, in our clinic, we offer psychological support for people who are diagnosed with HIV, and we actually have a team who are part of the BLMK psychology team that work closely with us to provide that support in the community. And then we have like an incredible HIV wellbeing support worker who she's out there kind of helping people when they've just been diagnosed, sharing information with them that they might need, and then a fantastic team of doctors that support.
Okay, so why is it important for an early diagnosis for HIV?
I guess the key reason early diagnosis is important is the quicker that you can get somebody on treatment, the better their health outcomes are. So if the virus has less of a chance to progress in their body, so we obviously are talking about HIV, people might not understand that we're talking about World AIDS Day and then really just speaking about HIV. So the HIV virus in the past was able to progress into the AIDS disease, which doesn't happen now because of the active treatment. And basically by ensuring people are tested quickly and accessing treatment as soon as possible, we are preventing the spread of the virus and improving their health outcomes.
So HIV disease and AIDS are two separate diseases, but they are progression to one to another.
Yeah, so AIDS is something that would happen after someone was living with the HIV virus for a really long time. And actually people don't die of AIDS, they would die of like AIDS related illnesses.
Okay.
So it's things like it affects their body's immune system and their ability to like recover from things. So like, I don't know, pneumonia or cancer or something like that might actually be the cause of death, but it's the AIDS related illness that means they can't. But that doesn't happen really now, like because we're so make sure people are detecting the virus early and accessing treatment.
Okay. That's something new for me to understand. Because yes, majority of people think that they are one and same, and they're one and same thing. So you have HIV or AIDS, same thing.
Yeah, no.
So they're not same. They're different, to be honest.
Yes, they're different things.
Okay. So in terms of the support, I asked earlier about mental health. So how do we support the people? How do we support people who are living with HIV in Luton?
Yeah, I think how we support people, how we support people most, I guess, is making sure that the service is accessible for them, that they get what they need, but actually also working to educate people in communities, to provide education just to kind of help with destigmatizing, like you and I have just discussed about the difference between HIV and AIDS and the fact that people might not know that. And actually, we need to treat people in the same way if they come to us and say, oh, I've been diagnosed with HIV, as we would if they came to us and said, I've been diagnosed with diabetes. It's a health condition.
Exactly.
And it needs to be treated as such. So that's why we do what we do, to support those people living with it. And actually, we do a lot of education when it comes to other health professionals, GPs or pharmacists, or maybe teachers or community workers, and how they can also support our clients.
Yes, indeed. And that's where the problem comes in play, because sometimes we think about these things too much without thinking that what effects it may be creating on a person who's going through this phase. And sometimes we end up offending people without knowing it. It's called unconscious bias.
Absolutely.
Which sometimes create. And on that note, I must say the time has passed so quickly for the first half. And when we are about to start on the second half, we will ask more questions regarding this, and we will try to broaden our scope in other areas as well. Hopefully, as you mentioned about the other sections. So we will, when we come back from the break, we will be talking about this and more. So stay tuned. We will be back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire 105.1 FM.
With him are the keys of the unseen, the treasures that none knoweth but he. He knoweth whatever there is on the earth and in the sea. Not a leaf doth fall, but with his knowledge. There is not a grain in the darkness or depths of the earth, nor anything fresh or dry, green or withered, but it is inscribed in a record clear to those who can read.
Enjoy quality and tasty 100% authentic halal Chinese and Thai food from Gao Express. Brought to you by the team behind Top Pizza in Luton. Choose from all your delicious Chinese and Thai favourites. Then order for delivery or collection from Gao Express in Wellington Street, Luton, Marketplace, Stevenage, and now also on Nightingale Road in Hitchin. Open daily midday till late. Find the number or order online at Gao, that's GAO, express.co.uk, or like Gao Express on Facebook.
Had an accident, a bump, trip or fall? Then you need Claims Specialists, your first choice for accident claims. The Specialist Claims Company on Dunstable Road in Luton. With excellent access to expert solicitors and on a no-win, no-fee basis, Claims Specialists use their 30 years experience to help get you the best compensation possible. For injuries at work, taxi, PCO and private hire incidents, road accidents and vehicle damage, medical negligence, plus rented housing disrepair. In short, when you need to make any claim, click on claimspecialists.co.uk or call 01582 733 222.
For the tastiest sizzling steaks around, book now for Taurus Luton Boot Street, LU1 2EP. And not just for the best grass-fed and dry-hung aged halal steaks, as Taurus Luton also serve amazing chicken dishes, burgers, sumptuous sides, salads and vegetarian options, with mouth-watering mocktails too. All this and with excellent service. View the menu, book your table, or even party or celebration event at taurusluton.co.uk or call 01582 750 213.
अस्सलाम वालेकुम, मेरा नाम किरण है। कोट कश्मीर ऑर्फन्स रिलीफ ट्रस्ट मेरा एक खूबसूरत घर है जहां मेरे साथ सैकड़ों यतीम और बेसहारा बच्चों की तालीम व तरबियत और पुरसुकून माहौल में परवरिश हो रही है, और ये सब कुछ आपके तावन से मुमकिन है। अल्लाह से दुआ है कि अल्लाह करीम आपको सदा सलामत रखे और उम्मीद है कि आप इसी तरह अपना प्यार, मोहब्बत और तावन जारी रखेंगे। कोट UK ऑफिस 0300123774 court.org.uk।
Are you thinking of starting a podcast or looking to give your podcast a new home? Why not hire Inspire FM's dedicated recording studio? With rates starting at just £25 per booking, our podcast studio is a fully functional, acoustically treated space for up to 4 people, and it's set up and ready to use as soon as you arrive. For more information or to inquire about booking, email us at info@inspirefm.org or send us a DM on our social media accounts at InspireFM Luton.
Would you like to be part of Luton's leading community radio station that has a growing global following? The answer is yes. Then we at Inspire FM are always looking for help in various departments, from admin to editing material to presenting. Interested? If so, come and join the Inspire FM family and help us to be bigger, better and brighter. Contact us by calling 01582 481 822. Text us 075 35 355 578 or email us info@inspirefm.org. Inspire FM, your radio station for the community by the community.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening, and today we are talking about World AIDS Day with our lovely guest, Kelsie. From Luton Sexual Health Services. This program is broadcasting live from the studios of Inspire FM today on 14th of November 2024, and the time just past 6:30. This program is broadcasted, as I said, live from the studios of Inspire FM today for our lovely people in Luton and surrounding areas of Luton, like Dunstable, Harpenden, Bedford, and our positive airways reaching to all our listeners who are listening us through Inspire FM radio app, website, or viewing us through Facebook live and YouTube live channels. So before we went on break, we were talking about World AIDS Day, and in the first half hour of the show, we have done extensive discussion on World AIDS Day and how the importance of red ribbon and how governments setting to goals to end HIV transmissions, the difference between HIV and AIDS, and the importance. So let me bring our guest, lovely guest, Kelsie from Luton Sexual Health Services. Good evening, Kelsie.
Good evening. Thank you very much for having me.
Thank you so much for coming to our show. Just for our listeners who are listening us, a quick recap. What is the importance of World AIDS Day?
Okay, importance of World AIDS Day: an opportunity to remember, an opportunity to reflect, think about those people living with HIV, challenge the stigma, and get a better understanding of what the picture is now.
Difference between HIV and AIDS.
Yeah.
And definitely, and why important, or what is the importance of detecting HIV earlier?
So really important to detect HIV early so that people can be on active treatment, that they can live long and healthy lives, and that then we can prevent the spread of the virus onto other people.
Mm-hmm. And we will discuss about the story of Red Ribbon again around the end of the show.
No
so moving forward, in terms of the HIV itself, now, as you mentioned earlier, that HIV did turn into AIDS if it's not been treated. So is HIV completely treatable, means person can be cured from HIV?
No, so we unfortunately don't have a cure for HIV. A person can be living with the virus, so living with HIV, and on treatment that helps them to have a healthy life, but unfortunately they can't ever completely cure the virus.
Mm-hmm. So a person who's living with HIV can have a healthy and normal life, and make sure that their life, their infection, the HIV infection, do not turn into AIDS.
Yes, just by making sure that they maintain on that regular treatment, which is called antiretrovirals.
Mm-hmm. Antiretrovirals. What is the full form of HIV, by the way?
What does it stand for?
Yes. I put you on the spot.
No, it's human immunodeficiency virus.
Yeah, exactly.
I just thought, as you said that, I was like, oh my gosh, I'm going to say that wrong.
Sorry, I'm well known for putting my guest on the spot.
That's okay. We don't mind.
So I know when we were discussing about the HIV earlier in the first half of the show, you mentioned, when I asked you what age group people normally get detected for this particular virus with, and you mentioned that on average in men's it's been detected somewhere between 35.
Yeah, around 35 is the average.
And in
Luton.
women's it's around 40 something.
45 as well, yeah.
Wow. So I must say they are kind of not a young age, a middle age one. So you mentioned that for youngsters, you guys normally go for
chlamydia
screening.
Yeah.
So I know it's all about STDs, which we mostly people say is sexually transmitted diseases and so forth. So why sexual transmitted diseases are so important for us?
So again, I'm going to do another little challenge you on a bit of language there. So we don't say sexually transmitted diseases. Most of these things, or all of these things, are infections, which we treat. So we call them STIs, sexually transmitted infections.
So that's one of the reasons whenever you mentioned STIs in the...
Yeah.
Now I got it. I was thinking, why are you saying STIs? What's STI? Is this another kind of abbreviation of something else?
Yeah, that's it. I think it's just how language changes over time as well. And I know that when I was at school, we were told about STDs with some very horrifically scary pictures that one teacher showed us in one lesson once. And then we never spoke about it again. But infection is the term we use because we really want people to know that it's something that's treatable. And like chlamydia, for example, it's a simple course of antibiotics to clear it up. Same with gonorrhea and many more things.
Mm-hmm. So people who are living or getting infected with these kind of infections, are they, some of them are fully curable, or they're just like HIV, not fully curable, but people can live with it?
So the only STI that we screen for that is not fully curable is HIV. Everything else that we test is something which can be treated. And I think that's one of the things why we really encourage people to access screening, because it's, without being reductive, not always as big a deal as someone might think it is.
Mm-hmm.
So getting a positive chlamydia test is taking a simple course of antibiotics, and then you'd come back for a test of cure, check those had worked, and that's fine. No further action required.
Indeed. And on that note, let me introduce our listeners as well. So listeners, if you have any questions or queries regarding our topic, which is World AIDS Day, AIDS Day, or STIs, so please give us a call on 01582 481822. I repeat, 01582 481822, or you can send us text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. So I remember in one of the interaction with public, I remember somebody asked you about the knowledge and education for youngsters regarding AIDS, and what kind of information is available, where are those available, and how can a youngster get those information. And now you mentioned that it is not a youngsters on average people get detected. So how can a person in their middle ages can get those information from?
So really, when we think about young people and accessing health information, we do a lot to reach out to those people. And actually, you can find Luton Sexual Health on Instagram. You can find us on TikTok. We actually managed to get 13,000 views on our TikTok videos in October.
Wow.
Yeah, so that's something we're really happy with, because it means that the information we're trying to share is actually getting out to the young people in a way that's accessible for them.
Mm-hmm.
But actually, our website, we spent a really long time building our website and trying to make sure the information there was simple and accessible as possible. We also have a language feature on our website, so you can change it to any language. And I've asked a lot of people that I know to check it for me, and everyone says it reads right in lots of different languages. So that means that people can just go to the top of the page and use a tool called Recite Me to change it to whatever language is most easy for them to understand, and access all that different STI information on there.
Wow. And it is funny because people, I remember there are so many people paint every single STIs with the same brush, thinking that, okay, a person who has AIDS or the person who has HIV or any other STIs are exactly same thing, which is not true, isn't it?
No, that's it. I think that we don't want to stigmatize anyone that kind of contracts any sort of virus, but it's really important to remember that things affect people differently. What might give one person symptoms, another person could go for months without knowing they have and be completely well and fine. Like we know with COVID that some people were incredibly poorly and some people would test positive for the virus and not know they had it. And actually STIs are quite similar than that. We don't actually know how it can affect you. So just because you're not showing any outward symptoms, that doesn't mean that you have never been in contact with anything, and that's why it's always about the testing. I was actually thinking, I wonder as well whether people know about the fact that their sexual health records are completely confidential. So if you come to Luton Sexual Health or order a home test kit, the account that you have and your sexual health record is completely separate from your GP record or your hospital record.
Oh,
yeah,
okay.
they're not linked to your NHS number. You don't need to provide any further information, and we don't have any sort of interaction with someone's GP or anything else. So it is a really private experience, and it is something that is really confidential.
Wow, that is a completely different ballgame altogether.
Yeah.
Because if those records are not intertwined or interlinked, it will give them a safety net to people who are thinking of getting themselves tested, or they may have some interaction whatsoever, or say they may have some kind of a infectious rebundle from those diseases, from these infections. Not diseases. I have to rectify my words now.
That's okay.
So in terms of HIV, what kind of infections we normally see in HIV, or what kind of symptoms we see in HIV?
I think that it really does vary from person to person. Sometimes people say like cold and flu-like symptoms. But obviously we don't want everyone that's got a cold or flu to be worrying that they've got HIV. So that's really important to mention. But sometimes it can be things like skin rashes, all sorts of different things that just alert people to the presence of a virus in the body. But actually, it would be quite a significant amount of time between maybe when someone had contracted something to when they would start to become ill enough to sort of seek medical attention or start noticing that they were feeling unwell or symptoms. Whereas maybe with something like chlamydia or gonorrhea, someone might just see a bit of a change to their normal bodily functions. So a little bit different discharge, different smells, different things that just alert people to the fact that there might have been a change that makes them think, actually, I want to get a test.
Indeed.
Or there might be nothing.
Indeed. So in terms of, I know education is very important. So do we have some kind of education programs for school kids as well, or university kids as well, or something like that?
Yeah, so we work really closely with the schools in Luton to support with safeguarding our most vulnerable young people and making sure that they can access clinic and get support around healthy relationships. But actually, we also work with the schools in different ways, from training the teachers just so that they feel supported in having difficult or challenging conversations, or maybe they don't feel that they have enough accurate information to then go on and teach other people about it. We might train teachers, or we sometimes go into schools and deliver targeted sessions where we can talk about things like healthy relationships, how you manage risk, how you keep yourself safe, consent, as well as having a general knowledge of contraception options available to you, STIs and things like that.
Wow. Because these kind of information, it's a bit kind of a tight, isn't it?
Yeah.
Sometimes you have to be very careful what you're saying, how you're saying, and to whom you are saying.
Absolutely.
Because yes, I know it's a very taboo topic.
It can be a really taboo topic, and I think that, like, I grew up in Luton. I've lived in Luton my whole life. I understand the town fairly well, and I know sort of what information young people need. And one thing that I have realized is that the issues that 15-year-olds face, or 16-year-olds or 18-year-olds face, is pretty similar across the board. So all we're trying to do is present them with the basic knowledge that they need to keep themselves safe, and just to alleviate any risks, because with the best intentions in the world, none of our young people will be doing anything they're not supposed to be doing until well into adult life and sensible times.
Indeed, yes.
And that's what we as parents always hope. But we know, yeah, exactly. We've all got our fingers crossed. I've got 2 children as well, so I know.
Likewise.
So what we try and do is just make sure that young people have someone they feel like they can talk to if they're worried. And we discussed this before. It might not necessarily be their parents they want to talk to, or a faith leader, or maybe even a teacher, but they just need to know that there are options available, and that no problem is too ginormous that you have to face it completely on your own. You can get support even when it comes to talking about sex and relationships.
Yes, indeed. And sometimes these kind of support mechanisms do help youngsters quite a lot, because I know youngsters have a very big appetite for information. They are like sponges. They want to absorb as much as possible wherever they can get their hands on information. And if we do not provide them guided information, they will get unguided information
from the internet,
from internet, from YouTube, or from other places, which will create a deviation from in their characteristics, and then you will think, hang on a second, that's not how I raised my kids. Why are they behaving in this way? And it is because if you do not provide them that guided approach, just like if you want your kids to ride a bicycle, you will give them those tools, you will give them those lessons in order to do that. This is not different from that, isn't it?
Absolutely. And actually, I think about that a lot, because I meet a lot of young people who potentially might have got into some trouble using their mobile phone. And I use the analogy about when our children are little and we teach them to cross the road. And when we get to the edge of the road, we hold their hand and we teach them to look left and right and when it's safe to cross. And they even know what to do in an emergency. So they know that if there ever was an emergency and someone was hit by a car, they might call 999, whatever else. We teach our children how to handle that risky situation. And then as they get a bit older, we kind of hand them over a mobile phone because it's the done thing. But we don't teach them to cross the road with that mobile phone. We maybe don't walk them through it as much, or we don't tell them what to do if they see something they don't like, or if they're nervous, or in case of an emergency. And actually, what we try and do is empower parents to have those conversations with their children themselves. Like, if you don't know how to have this conversation with your children about how to get the accurate information, then come to us. We have the really privileged position of being a sexual health service that are part of Bedfordshire hospitals. We're funded by public health. We are part of the NHS, and we go into schools just to give that factual public health NHS sort of knowledge. Everything comes from a really neutral point. It's not about personal opinion. It's not about who should be doing what and when. It is just about whether this is relevant to you now, whether it might be in the future. Here's your options. Here's some information you might need to know. Here's where to get some support if you need it.
Indeed. Coming back to the topic of AIDS itself, or HIV, you said that HIV is not fully treatable, but there are some treatments we can put in place. It's a lifelong diseases. If it's a lifelong disease, isn't it?
Yeah, so HIV is treatable, but it's not curable. So we can make sure that people are on treatment, which means they're healthy. We monitor their bloods regularly, maybe every 6 months, that sort of thing, to check for any other conditions that could affect their health and help to keep people well. But actually, we can't there is no cure at the moment. We were actually talking about that at work today, how fantastic it would be if they just developed a cure for HIV.
Well, who knows? Previously, the other things like chlamydia and all those syphilis and all the other STIs
were incurable,
but they're now a cure there.
And even still, like, there never used to be a cure for hepatitis C in the past, and now there's a cure for hepatitis C. So we're working on it.
Who knows? We can have a cure for this one as well. So in terms of HIV itself, what sort of support is available for people living with HIV or AIDS, and how important for them to why should one go and get themselves tested for an HIV?
I think the thing I would say is that the reason why we would encourage people to get testing is that HIV affects all communities. Statistically, on paper, every community in Luton is affected by HIV. There is no way around that. And Luton is classed as a high prevalence area. And so if people want to support with the testing and with prevention, the best way they can do that is to know their status. So if you know that you've got the virus, you can access treatment and you don't pass it on. If you know you haven't got it, you can take steps to protect yourself. I think that's the key point.
Exactly. And that's a very, very important point in order to protect ourselves and our loved ones and make sure necessary treatments are there. So so a person who is being affected with this virus, so how can they make sure that they will not transmit this virus to somebody else?
Yeah. So there is a few things that you can do to make sure you don't transmit HIV, that HIV can't be transmitted. And I think if we just go back to basics, the most simple way that anyone can prevent HIV transmission is by using condoms. So free condoms are available from Luton Sexual Health for under 25s and over 25s. We're really lucky in this town that it's across the board. People can get those, they can text and get condoms delivered to their door, or they can pop into our service, all sorts of things. That's one of the ways. Another way is, we mentioned a little bit about that PEP and PrEP, those preventative medications for people who are either most high risk or maybe have reason to believe that they've been in contact with HIV already. And then it's those people who have HIV and are living with HIV get into that U equals U, undetectable. So that's talking about an undetectable viral load. So such a small amount of the virus in your body that it's no longer worth noting. It's undetectable. And then that means that they then are untransmissible. They can't pass that tiny bit of virus on to anyone else.
Oh, that is definitely very good to know. That is very good to know. And on that note, I must say, wow, the time has passed really, really quickly. We just have under 4 minutes left to end this show. So coming back on this topic, what are the key messages would you like to share with our listeners?
I think the key messages I would like to share with your listeners is to encourage people that HIV testing is for everybody. It's simple, it's free, and it's confidential. You can come into a clinic and get tested, or you can get tested at home. That HIV shouldn't be associated with the prognosis that maybe it was once had, and it shouldn't be associated with the same stigmas that it had in the past.
Indeed.
And unfortunately, it does affect all communities.
Indeed. And that's one of the things, because people are so scared still this day. They are so scared to talk about these kind of things that they do not know what to say about or how to react in that manner. Is it being transmitted to bloods as well, isn't it?
Yeah, so it's a bloodborne virus. So it can be passed on in lots of different ways. So HIV could be passed on from blood to blood, say like through a shared needle or something like that, through sex, through childbirth, and through breastfeeding are all ways that HIV could be passed on if someone didn't know they had it.
All right, okay, and that's one of the reasons it's best to get yourself tested.
Absolutely.
With these ones, and on the World AIDS Day, which is on 1st of December, we will try our level best to create as much awareness as possible by wearing the red ribbon.
Yeah, that's it. And if you want to, on the Friday the 29th of November, pop down and see us outside the Hat Factory. We'll have those home test kits available to hand out to people. Free hot drinks, free condoms, red ribbons, anything else you might need.
So what time to what time?
So we'll be there from 2:30 till 5.
Wow, okay, so whole day. That's really nice. 2:30 to 5. So
for the afternoon. Unfortunately, our clinic shuts at 1:30, so we have to keep up our clinic capacity in the daytime and then head out afterwards.
Oh, that's nice. That's really nice. No, it's good. It's good to have that awareness for people. For generalized people and getting those knowledge. Knowledge is key. Sometimes people, and I must say, youngsters nowadays have the best depository of knowledge. Sometimes they have such a good example or such a good explanation to things like these. Majority of the adults cannot able to give that kind of an explanation.
I think as well, like young people just don't have the stigma that maybe adults have because they're only living in this millennium. They don't know or care really about things that happened in the past. So it's maybe easier to talk about with young people.
Indeed. And on that note, Kelsie, I must say thank you so much.
Thank you so much for having me.
Coming to our show today and giving us such a great information about this topic and general awareness of this topic. And we will definitely want to see you again to discuss more about STIs.
Yeah, of course.
And how we can share information about those and how we can eradicate all those kind of necessary stigma out of that. Okay, thank you so much, Chelsea.
Thank you.
So that's all, guys, for today's show. Thank you so much for your questions, your comments, which has received, your love, which you have sent to us. We will be back again next week with another topic, which is winter vaccinations, with our colleagues from NHS England vaccination team, who will be coming next week and discussing about what winter vaccination is needed for us. So do remember us in your duas. Until next week, Fahad Matin signing off. Assalamu alaikum.